Today we're going to talk about the MVX test, which I think is probably the most important test you need to take that you don't know anything about, right? That's really what it comes down to. Let's talk about what is the MVX test?
The MVX test stands for Metabolic Vulnerability Index, and it was created through a process since 2018 by a team of researchers through LabCorp, which is a international lab company, and they got some other testing through the NIH, National Institute of Health, on 24,000 people. And it does several things. Number one, it gives you a score for your health, 1 to 100. You want that score to be very low. And it also will predict your longevity in the next 5 years, or I should say mortality. It actually has a mortality incidence rate, depending on your score, on a scale of 0 to about 70%. So like if you have a really high score, let's say like 80 out of 100, then your mortality chance is very high in the next 5 years. If it's low, like 30, your chance of dying is like 3%. So you want a very low score. It also gives you a path to choose to take to improve your health. So it measures 6 factors, and these 6 factors can be improved through nutrition only. Drugs do not help reduce your score, and so it'll give you a path such as detoxing metals and chemicals, or getting rid of infections and inflammation, or nutrition such as amino acids or vitamin B1. So it's a very specific, fantastic, and very inexpensive test that it just got released January 6th of 2025.
And when you say inexpensive, what's an average cost of the test? Because we know some lab tests are hundreds or thousands of dollars.
I charge $135. Other doctors will charge more, others will charge less.
Yeah, but that's really reasonable for a test that's going to determine or give you information whether or not what your percentages of dying in the next 5 years. So I think that's a really
Yeah, and how to reverse
$135 is
that.
really reasonable. Yeah.
Yeah.
So you said this was done on like 23,500 people or a whole bunch of people. What why why was this just something they were tracking, or was it just a accumulation of different tests that they realized there were these factors and they made it into one test? What's the background on it a little bit?
Well, the background is this. So, one of the researchers, Dr. Bill Cromwell, he's a lipidologist. He started his practice in 1988. So during that time, there was the cholesterol scare. And, it goes back decades before that, and still now, conventional MDs are harping on LDL as the worst thing. But in 1988, this Dr. Cromwell was having patients come to him saying, "Hey, my cholesterol is high. I don't want to die. What should I do?" Well, Dr. Cromwell, he's just brilliant. He asks the right questions, and he's like pondering, like, well, maybe LDL isn't the worst thing. And if it's not, then what is? So combine his brain with a bunch of other researchers at LabCorp, and they studied, I'm going to say about 30 factors in the blood and different ways of testing those 30 factors. And they came up with 6. And they have to be tested through what's called NMR, which I don't want to get into, as opposed to PCR. But NMR is how you measure these 6 factors. And then they do some math, and they give you these scores. So not only do you get like the big score, 1 to 100, but you also get the ranges of the 6. And the 2 main categories are malnutrition and inflammation. And so with those 2 categories, you also get a score. So, and that's been like what I've been doing since it got released, like looking at these numbers and how do we make them better? Do you want some to go up? Do you want them to go down? What if this goes up and this goes down? Like you got to put it all together. And you want that overall score to come down.
Sure. You said there's 6 factors. Should we talk about what those 6 factors are just briefly?
Yeah, I'll do it really briefly.
Yeah.
So the first one is called glyc, which is a measurement of inflammation and infection.
Mm-hmm.
And it's a combination of other factors that you may have heard of, like homocysteine and C-reactive protein, and also like white blood cell remnants. So like if you have a white blood cell that's been damaged because it's battling infection, it'll fall apart. So those remnants are part of glyc. Another factor is called small HDL particles. And so again, getting back to the LDL discussion,
Mm-hmm.
it's not LDL that's the main problem. You want a high number of these small HDL particles because they soak up LDL. And another factor is called citrate. So citrate you want that to be at a good number. If it's too high in the blood, that means that you're toxic. Your body's filled with toxins, and the citrate can't get into the cells. Now, citrate is like the first step of mitochondrial function of the Krebs cycle, and that's some science that you may not understand. But the point is, your body won't make energy unless it has citrate. Okay. Then the last three all come together as a group, and that's called the branched chain amino acids, and they're valine, leucine, and isoleucine. And when you have a low number of those, it means you're not making muscle, and your body can't digest it, or you're not eating enough. So we want to fix that. And so they all, when these numbers are off, the end result is like the end of life. People call it frailty. They call it sarcopenia, which is muscle wasting. They call it cachexia, which is like when people have cancer, they can't gain weight. And so you can reverse engineer this as long as it's not too far gone, right? When you're like 40 years old, like I'm 53 right now. So I've reduced mine dramatically. My score was 55 back in January, and now it dropped down to 31. So it dropped 24 points in just 4 weeks. And there's reasons why. And then I had my third test run, and at that time I had a sinus infection, and so it went up. Let me just explain this because it's super interesting.
Yeah.
So my first score being 55, 1 month earlier, I had discovered a gas leak at my house. So I was breathing in gas from the gas meter, which was outside, for a year, and it was so bad I had trouble breathing, high blood pressure. I actually went to the hospital in May of 2024. On a Saturday morning, I had crushing chest pain, and then in December of 2024, I found the gas leak, and I was able to fix it. So in January, I had my first MVX test run, and it was very high at 55, which gave me a 20% mortality incidence for the next 5 years. So just having not gas leak and breathing regular air, and then in February, I redid MVX, and it dropped all the way down to 31. So now my chance of mortality is 3%. So it dropped 17% in 4 weeks just because I wasn't breathing in gas. And then 4 weeks after that, I had the sinus infection, and it bumped up a little bit to 39. So it went from 55 to 31 to 39. So the point is, what's your first obstacle for improving your health? Is it some kind of toxin or collection of toxins? Is it some kind of infection or collection of infections? Or another aspect is the nutritional part. So when I had the gas leak and I felt so bad in May and went to the ER, 10 days after that, since I'm in the nutrition field, I'm going to make this long story short.
That's right.
I started taking B1, vitamin B1, which is benfotiamine. And it's a version called benfotiamine. The B1 saved my life. In 2 weeks, I was 95% better. So it kept me going through through 2024. But again, that's part of MVX test. My B1 status was good because I'd been taking it for the whole year before, almost a year before.
Those 6 factors, we talked about this one point, they actually align up pretty well with your 7-step blueprint, right? To optimal health.
They do. So my 7-step blueprint is the solution to the 6 factors. And it's like almost one for one. Like my 7 steps are not too much or too little to address the 6 factors of MVX. So I spent, let's say, 30 years developing my 7-step blueprint to optimal health. The graphic that I made for the 7 steps, I created in 2018, I believe. And so I had the solution for MVX, 7 years before MVX was even released. And it's just like, if you have truth somewhere, you're going to find that same truth everywhere. So this is how you get your body better, is by doing these 7 steps. And they address the 6 factors of MVX.
And let's talk a little bit about how it was released, because you're pretty integral in getting this released, because before it wasn't available to the general public, right?
Right. It was used by the government for the research. And when I found out about MVX, it was at the beginning of 2024. And there was a video that appeared on YouTube, and I watched that video 6, 7 times. Like, this is the best video on YouTube. What the heck is this test? What is it made out of? And when I figured out what these 6 factors are, it's like, oh, I have the solutions for these 6 factors. I know how to fix this. So what happened next was I started calling labs to try to get them to run MVX, including the lab at the NIH and they wouldn't run it. They gave me a couple reasons. They said they're waiting for consensus, which I don't understand that statement at all. And they also said it doesn't measure disease, and that's a problem. And I said, well, yeah, I get it. That's the problem with medicine, is that they're always measuring disease. This test actually measures health or lack of health. And I had another lab tell me they didn't want to look like witch doctors. Well, I didn't get, and I called 6, 7 labs, including NASA. I know somebody at
Hmm.
NASA. And so this is going on for about 4 or 5 months. And then in January 6th of 2025, I was on the phone with a lab. The way that it happened was I had a question about one of the factors, one of the small HDL particles. I just had this one question. And I was talking to this guy on the phone, and he answered my question. And I, thanked him for it. And he gave me a little backstory on the answer. And we're kind of chatting a little bit. And I said, I'm just really excited about MVX. And he said, we have that. And I said, I know you've run it on 24,000 people for the NIH, which I didn't know they had it. I didn't know that this was a lab,
Oh,
right?
wow.
There's a third party that orders it. He goes, yeah, we did that. And I said, but I can't order it for myself or my patients. He goes, oh, just give me 15 minutes. I'll turn it on. This video is brought to you by my office. We use new and old clinical discoveries solving complex chronic illnesses using only diet and supplements. We have this fantastic building. We have multiple practitioners. We do local and distance consultations. We help you improve your health as opposed to just squashing symptoms. And we have a variety of opportunities for you to get involved. We have ebooks and courses that are free. We have ebooks and courses that are paid for. I have my large 7-step Blueprint to Optimal Health online course, which walks you through the 7-step Blueprint to Optimal Health, and you have access to all the supplements at patient pricing. My book is available on Kindle. If you want to buy supplements from my office, we have this store, which is for patients only, and we have this store, which is for everybody else. But if you just want to jump into direct care immediately, just contact the office directly. He goes, oh, just give me 15 minutes, I'll turn it on. Like that. So there we go. Since then, I've been running MVX. I've run it on lots of people so far.
Yeah, it's amazing if you know what you get when you really ask. If you just ask. The
Yeah.
Now is this, because this is such a huge indicator of, like you say, you're measuring health or lack of health. Do people still need to do other tests, or would it be, I don't say need to do, but would it be beneficial for them to do other tests like a PSA for men or something, or things like that? Or is this really the only one they need, or is this the primary, maybe the one they need, and the other ones are just complementary?
This is the first test to start with. And of course, PSAs and all the other tests that are available are still needing to be used. But the question is, for what purpose, right? To measure disease, that's
Right.
one purpose. But in my healthcare practice, I've been trying to improve health. So that gives us a different perspective on lab testing.
Hmm.
So with MVX, some of these 6 factors, you just start a nutrition program, you start a detox program or something. But other factors will tell us, now run this next test.
Mm.
And that test might be to find out why you have inflammation, or another test to find out how many organisms you have or microbes you have living in your body. Another test would be to find out what are the toxins you have in your body and how much. So MVX directs us where to go with the next test and with therapies.
So it is the primary. It's really should be the first test that everybody runs, or I guess it should be the next test everybody runs. People's normal physicians are testing for disease.
Right.
So if you go into your doctor's office and say, "Hey, I want this test," they're probably not even going to know what it is, right? So they need to
No.
come to someone like you, who's actually measuring for a health or lack of health. So don't be surprised if someone, you hear about this test and you go to your doctor and they're like, "Yeah, I have no idea what that is, and it's really not important." So it's just you got to be educated. I mean, that's what we're
Right.
talking about.
So the other aspect of this is that when medical doctors find something on the lab that's off, they're responsible. So, if your LDL cholesterol is too high, they just give you statin drugs. They are legally responsible to lower that LDL. And if they run a test that they know nothing about and they don't know how to fix it,
Hmm.
then chances are they're not going to be so happy to even run the test in the first place. And the other aspect of this is that there's no drugs that fix MVX. Drugs cannot lower the score. Drugs may keep the score the same or make it higher, but the way you fix MVX is by repairing the biochemistry of your body. And the way you do that is with nutrition and cleaning, detoxing the body,
Awesome.
and diet.
Yeah.
Yeah.
So let someone come and says, okay, Dr. Schmidt, I want to do the test. They arrange your office. They arrange it through your office, right? And then what's the process? They go, what is the process?
Okay, they go to the front page of my website,
Mm-hmm.
and in the upper right corner it says MVX test. Click on that, and a page comes up. You put in your information, and someone from my office will contact you and arrange payment, and they get the requisition to you, and you print that off, and you take that to LabCorp, and it's officially called MVX Plus.
Okay.
And then you take that requisition to LabCorp, and they draw your blood. It's just one vial.
Okay. And then results come back probably within, within a week. I mean, usually.
Within a week, yeah, we get it, and then we send it straight to you.
Right. And then,
Yeah, with
and
an
then
explanation, with a little, with a video that I made on how to read it. And
Right.
if you want to go further, you can get a consultation with myself or one of my other practitioners. And if you want to become a patient, then you can do that. So with MVX, you can use that main score and all the other scores as a report card and like a grade card, if you will, on your care for yourself and your doctor's care. So you want that number to come down. And if you're doing some therapy and it doesn't come down, then you got to change up your therapy to something that will work. So this is a grade card / report card for yourself and your doctor and basically the whole healthcare system. And this would point people in the right direction. Like you want to find the doctors that lowered the MVX score.
Mm-hmm.
And right now, I'm the only one in the country that's trying to figure out how to lower MVX. And I've had some success with myself, and then we have some patients that are working on their scores. But we're brand new at getting some clinical results lowering MVX.
No, I'm just saying it is the ultimate. It's the ultimate health report card. I mean, that's what this is.
Yeah, absolutely. Yeah, for sure. Yeah,
So you're
and
okay.
I've talked with some of the researchers, and they had no idea that MVX will fluctuate so much from month to month based on your actions or your exposures. And they thought that MVX would be the same number for the next 2 years, and it might budge a little bit. And they also have no intention on using it clinically. We're talking about PhDs and MDs they've done studies through Duke University where, for example, they had some guys, older gentlemen with high glucose, and they put them on treadmills and they're exercising, and they ran the MVX test before and after, and their blood sugar dropped and their insulin resistance got better, but it didn't change MVX. And I told this researcher on the phone, yeah, because exercise is not part of my 7-step blueprint to optimal health. So I could have told you it wouldn't work. And the other study they did was with statin drugs to lower cholesterol. MVX did not lower with the statin drug. And I said, yeah, that makes sense because drugs are not part of the 7-step blueprint to optimal health. The things that will fix your chemistry and improve your chemistry are in the 7-step blueprint, and is basically cleaning the body, detoxing, getting rid of inflammation, microbes, and toxins. That's the core.
Do you foresee this ever becoming more mainstream, or is this something that you're going to have to be in the know to just know about?
Will this become mainstream? Boy, that's such a good question. If it becomes mainstream, it's because people will want to have their health improved. Okay, so I think a lot of viewpoints right now regarding health are, I have a symptom, I don't want that symptom. So then, and that's easy, right? Like doctors have 1 million drugs for 1 million symptoms, and it's an easy way to think, right? Get rid of my symptom.
Right.
And you can, sometimes some drugs will work in 24 hours, like Benadryl or whatever. But you're never getting to the cause. The problem never goes away permanently. And what you really want to do is fix the cause. And as you go through that process of fixing the cause, then you might have some ups and downs and, maybe not feel so good. But over time, you feel better and better, right? So the results are not so instantaneous, although they are more complete and cheaper to get to.
Yeah.
and it takes a little bit of work, meaning, taking some supplements and changing your diet. So in order for this to go mainstream, we need a lot of people to understand that to get your health back, you have to work at it. And the other thing is, if insurance companies really want to help people, then they should change their process to improve health also, as opposed to treating symptoms or treating disease. And that's the whole point of health care anyways, right? Is to actually improve people's health. So if you're really in this industry, use MVX to rate or to grade your processes and your therapies. And so like if I had an insurance company, I would mandate all patients start their care with an MVX test. And then the doctor can say, well, my therapies will last 6 months or however many years. They should have MVX testing once a quarter, for example, to look for progress. So will it become mainstream? Maybe if some people at the top, maybe the Secretary of Health and Human Services, maybe that person can push for MVX testing on a regular basis throughout the country, depending on what are variables that need to be taken care of, such as health insurance payments, or maybe some like motor vehicle accident lawsuits. You got to do, and MVX needs to be implemented in some way from the top and from the bottom, so patients can run this on themselves through my website and get a score and kind of rate their progress with their doctor's care.
Right. And from a frequency standpoint, you kind of just covered this, but a lot of people just have annual blood work, but something like this where you ran it every month, at a minimum, what would suggest at a minimum probably quarterly, because it is pretty cost effective.
Yeah, at a minimum quarterly, right? And if you're really healthy, then you can just run it once a year. Just make sure your health is maintained. But like if you're actively trying to improve your health, you can run it monthly.
For instance, like with you probably were shocked to find that your score was high, right? And then, but it came down substantially in just a short period of time. So the fact is that if someone runs their score and they get a score they don't like, there are things that can be done. It may not be the big of a swing as that you had, but there are things that can be done to substantially improve their risk factors in a short period of time.
That's correct, yeah. And the MVX 6 factors will tell you where to start first.
Right.
So there's one person who ran his test. His score was the second best score I have seen. His score was 23. And when I looked at his numbers, though, I said to myself, well, he's eating too many carbohydrates. I can tell he's got some infection or inflammation or something. And when I actually talked to him on the phone, he's a chiropractor. And, hey, you have a really good score, but I can see that you're eating too many carbohydrates. And he said, yeah, I eat sweets and I get these infections in my teeth.
Mm.
And so like I told him, like, don't have an ego because you have a really good score. You have things to work on.
Oh yeah, totally right.
Yeah.
I guess that means even if you're doing really really great, you can always do a little bit better, right? And
There's always room
something.
for improvement.
Yeah, and like I said, there's things that can affect your score in a short period of time. So it's one of those things
Right.
where that's why you might want to run it more often, because you might have an infection or sinuses or allergies or whatever.
Yeah. And I do want to say this, that there are some people with a score of, let's say, I'm just going to say like 50. Their score is 50. And some of them are 70, let's say 75 years old, and other people are 40 years old. I'm just saying, like, age is not a factor.
Right.
And that's one thing that MVX has been shown, that when you're trying to predict mortality, or I'll say longevity,
Mm-hmm. Yeah.
it used to be, how old are you?
Yeah.
Are you male or female? Have you had a heart attack, or do you have chronic kidney disease? Those were the main factors. Also, the smaller factors were, are you a smoker? Are you overweight? Like, those are minuscule as far as predicting longevity. But now that MVX has been invented, it contributes to 60% of the prediction of your longevity. 60%. And then all these other factors become very minuscule. Like that, gender, age, smoking, weight, past history of disease. Yeah.
And you would think that companies like insurance companies, if they were to like a life insurance company to have any type of policy issued, if that they would require this test to be done to determine policy rates, because it seems like that's the for them what that would want to use that. So, like I said before, hopefully it comes from top down, but a lot of these things happen from a groundswell, or people going, "Do you need to be having this test, or you need to be looking in this test?" Right?
Right.
Yeah.
Yeah, but with the insurance companies, it shouldn't just be like take the test and see what your score is, and then here's your rate because your score is whatever number.
Right.
It should be you're going to run this MVX score once a month for 3 months or
Yeah.
something like that, and see if the number comes down. Because if it's coming down, it means that that person's health is improving. So if you're an insurance company, you want healthy people,
Right.
or you want people who are working on improving their health.
Right.
So if you have a score and it keeps going up and you're an insurance company, you don't want that person because something's not right.
Yeah.
They're not doing the right stuff. They got the wrong doctor. They're having, some kind of a poor lifestyle choice. Yeah.
It's like discovering a new molecule or something. It's just amazing the fact that this test was being run, and then nobody really knew about it. And then from a phone call, I mean, you were able to facilitate this going on. You said age is not a factor in who should get this test. So even someone who's younger, early 20s, should they be testing this? Is this a test they should be getting?
Yeah. One of my really bad scores that I've seen on all the people that have run this test, this woman was, she's in her 30s and her score is very high. And she's not a patient. I don't know her history. I don't know if she has some diagnosis or something. But yeah, you can be young and still run this test.
All right. Well, this has been great. This is a test I think everybody needs to have. If you see this or read about this, they need to call your office and schedule the test. Right. So,
Right. And so, like, it's more about longevity and improving your health so you can live longer and be healthier at the same time.
what else do you want?
Right. Exactly.
All right. Thanks so much.
Okay. Thank you.